Welcome to this live special report on COVID-19 from the Washington Post. I'm Libby Casey, and I'm joining you from here in Washington, D.C. Here are the latest stories we're tracking today. More than 17 million Americans have filed for unemployment assistance in the last 4 weeks. And so this is now the worst level of joblessness since the Great Depression. The Federal Reserve Chair, Jerome Powell, says the economy is deteriorating with alarming speed, and he's calling this an emergency. Meanwhile, on attempts to slow the spread of coronavirus, the nation's top infectious disease expert, Anthony Fauci, says it's highly likely that this social distancing effort people are making is working. But Fauci is cautioning that people still need to keep up their efforts and remain home if they can and take safety precautions. Now, even as many Americans are hunkering down and trying to minimize their physical contact with others, there are some among us deemed essential workers who are still on the job. They're keeping the nation running, from running planes to keeping the food supply going to deliveries to, of course, doing the vital healthcare that's happening on the front lines. So we're going to talk about these essential workers later on in the show, who they are and what they're sacrificing. But first, let's talk about just who COVID-19 is infecting and killing in America. I've got a couple of guests who've been working on this question and digging into the data that's available to us so far. So the Washington Post did an analysis of some early data that came out, and they found that the coronavirus appears to be infecting and killing Black Americans at an alarming rate. And that's been the basis of reporting done by Vanessa Williams, who I see is joining us here in just a moment, national reporter who's been digging into these numbers with a couple of colleagues of hers to report on that. We'll also be learning more about one specific community and what it's doing. Vanessa, welcome so much. Thank you for talking with us today.
Thank you for having me today. Glad to be here.
So, it's so fascinating to look at just how you even got a hold of this data because it's so piecemeal and there's so many questions. But first, let's just go with the big headline. Talk to us about the alarming rate, the disproportional rate at which African Americans are being hit by coronavirus.
Well, as our reporting has shown, it varies from city to city, and we've had to, as you pointed out, piece this information together because right now the Centers for Disease Control, which keeps track of cases and deaths nationwide, has not started offering that information, positive tests and deaths by race yet. They do it by gender, they do it by age, but not by race yet. They cite uneven reporting from states and counties. That's the reason why they can't do that. But apparently they are working toward providing that information. But what we've been able to find out from our own reporting is in areas that have large concentrations of Black people, particularly areas in which Black people suffer some social and economic disparities to begin with, that the rate of death is much higher than their proportion in the population. I wrote a story about a community in Southwest Georgia, which is outside of the Atlanta metropolitan area, that has had more deaths than the Atlanta metropolitan area, which is 10 times larger than this county, Dougherty County in Southwest Georgia. And people might know it by the name of the main city there, Albany.
I want to welcome Robert Samuels with us. Robert, thank you. I want to hear more about Georgia, Vanessa, in just a moment. But Robert, first of all, you profiled and looked at one specific community, and I want you to talk to us about what you found, why your focus was on this community in the Milwaukee area, and what they're facing.
Well, when we started to notice the disparities between African Americans and whites when it came to COVID-19, the city of Milwaukee and Milwaukee County in general really stuck out. Now, we know Milwaukee is one of the most segregated cities in the entire United States. And we saw the numbers there being particularly stark. Even in Milwaukee County, about 28% of the county's Black, but they're accounting for about 70% of the deaths to COVID-19. And so we went there to sort of try to understand why this was happening. And again, we saw these continual patterns of segregation really harming the lives of African Americans. Not only are we talking about the higher rates of diabetes and asthma and respiratory infections that are exacerbated by the way the disease works, But there's so much more than that. We're talking about communities that only have one grocery store, that only have one hospital, where their gas stations are closed, where the places that you'd go to if you could not afford things like food pantries are closing at very fast rates because they cannot get volunteers. And what this means is that you have communities out there that cannot simply stay at home, because to do the things that require you to live, to eat, to be able to pay your bills, all those are outside of your neighborhood. So you have a community where people have to leave to maintain themselves and are increasing their risk of exposure.
Robert, you start your piece by talking about a 66-year-old veteran and retired firefighter who died, and his family wasn't sure where he got it. I mean, he was doing just what has been recommended and trying to sort of social distance and hunker down. How is the family coping with what's happened, and how are they thinking about it?
For the Riley family, Lawrence Riley was the first person in Milwaukee County who died of this disease. And it's a big mystery to them because they say their father was a homebody. And their father was also a very strong man. He withstood two heart attacks, strokes. He broke his back. He was a firefighter, and this is what crippled him. So for his family, it's a very hard road. And they are also figuring out why their neighbors are suffering the same fate. When the data can only tell us so much, but when you hunker down in a community and you see victims on 32nd Street, on 44th Street, on 57th Street, on 58th Street, you start to realize the grave impact it's having on particular places in great concentrations.
As we've been talking about social distancing, and especially as we head into this like Passover and Easter period, we heard Trump just a little while ago encouraging people to go out and celebrate together at Easter. He's now backed away from that. But Vanessa, you paint a very poignant picture of what happened in Albany, Georgia, and how one gathering there may have been sort of the nexus for an outbreak, and why that's so important right now as we all talk about continuing social distancing and not going to church this weekend and not having seders with family. So Vanessa, what do we know happened in Albany, Georgia?
Well, according to reports as well from both officials and the community, there was a couple of funerals actually, one in late February and another in early March. And it is believed that someone from Atlanta who came down for the first funeral had the virus, but nobody knew. A few days later, this person was hospitalized and actually died. And then it was learned that this person had COVID-19. And then the community started to see people who had been to the funeral, family members, as well as some of the employees of the funeral homes that handled the services, as well as some of the churches, or the two churches where the services were held. And one person I interviewed, a city council member, said that these funerals were large and they drew a cross section from the community: police officers, teachers, just a lot of people. It's sort of a close-knit community there. It's not a huge city, and the Black community is, everybody knows everybody and everybody socializes. So it spread from there. I should also point out that this person I talked to said that initially people thought when the word first started circulating about COVID-19, it was, you had to have traveled overseas. That doesn't affect us. He also said that people got a false sense of, safety, if you will, because they were not in Metro Atlanta. Like, we're tucked away out here, away from all of that. Maybe we'll be safe. And one thing I do want to address, people in Albany are very frustrated. They're upset that it seems that people are blaming, quote, Black people for this, but that is really not what we're talking about here. There is nothing in science that suggests that Black people are inherently or genetically more inclined or prone to be infected. This has to do with, as Robert pointed out, generations of inequality, economic, social, and particularly in the medical community, where there's a long history that some of us know well of just sort of mistrust, lack of access, lack of fairness in treatment, So these are the issues that are driving this. Plus, as he pointed out, the comorbidities, the underlying conditions, and as the same as with people in Milwaukee, there are people in southern Georgia who work at plants that are still operating, food plants. There is a Procter & Gamble paper plant there that's still operating, and folks have to go to work because what else are they going to do? So these are the issues that are at work here. It's not that there's anything wrong with Black people. It is, again, the social economic inequities. And, it's interesting. I've gotten a lot of mail this week from people who kind of don't want to believe that, but that really is what we're talking about here. And I think that's important to point out.
Vanessa, you have this quote in one of your stories from the Albany City Commissioner, who says, historically, when America catches a cold, Black America catches pneumonia.
Mm-hmm.
What does that mean?
That means what we've just been talking about here, that you have a community that already doesn't have great access to healthcare facilities in Georgia and a lot of other southern states where lawmakers declined to expand Medicaid coverage for adults because they didn't want to participate in the Affordable Care Act, AKA Obamacare. You have, like I said, lack of access. And as a result of that, a lot of hospitals have closed. There's like one hospital trying to serve the community in Dougherty County, Albany, and it has almost, sort of buckled under the pressure. The governor had to send in the National Guard, who brought nurses and doctors and nurse practitioners to help, because there are no hospitals out here in these rural communities because they can't afford to keep them open. People can't afford to pay for services. And it really is a dire situation.
Vanessa, a couple of weeks ago, you reported a piece about a poll that had come out that found that Latinos and African Americans were more concerned about coronavirus than white Americans. When you talked to a researcher about this, what were the reasons and how is that bearing out?
Yes, that was a Pew poll. And the reasons were the ones that we've just been talking about here. People were concerned that they didn't have the ability to work from home because they didn't have jobs that you could do, like Robert and I are doing now, do from home. You had to go out and drive the bus or stock the shelves or empty the bedpans. So you have low-wage workers who can't afford to stay home, who can't afford to social distance in that way, who, again, don't have great access to healthcare because there's not a clinic in my neighborhood. I can't afford to go to the emergency room. Maybe I've got a problem that my high blood pressure or my asthma because, there's, toxic gas is spewing into my neighborhood. Again, that's something we haven't talked a lot about either. A lot of communities of color, low income communities of color, face environmental concerns, bad water, bad air. So people are concerned that, my goodness, we're already struggling and sick and not well cared for. If this virus gets into our community, we're going to be harmed even more. And I think the statistics we're seeing bears that out some. Robert, you agree, right?
Go ahead, Robert.
Yeah, I think there are a few things. When you talk about the idea of even going to a hospital, right? In a time when supplies are few, I think there are a number of people within those communities who wonder whether or not they'll get the adequate treatment. When we spoke to one of the families of one of the victims, whose name was Roderick Crape, his family talked about, this was a man who was obese, who had diabetes, who had several heart conditions. And when he got to the hospital, he died 8 hours later. And he had the time to take a photo of himself in the emergency room and post it on Facebook to say that he was in the hospital. Now, if that were my relative, my first question would be, how did this man have so much time, knowing that this disease was out there, knowing that he had these conditions that exacerbated to the point where it's deadly, and yet he had time to take this picture? And so I think there are some real questions that are being asked from communities that have experienced the sting of segregation about whether or not they'll be treated fairly. And the other thing that I think is important is to note is that a lot of these places that we're seeing these grave disparities, the Milwaukees of the world, the New Orleans of the world, the Detroits of the world, they have families that are multi-generational families, that you have homes where just by the nature of putting them together, you have grandpa and grandma living with a young child, a teenager, someone who has to work. And that's the way those units function. And so the idea of having social distancing within those family units is very impossible. And so I think the questions that are being asked to the CDC from a number of Black activists, from lawmakers, are can we get some information about how these resources are being deployed and who's being hurt? Because the conditions within particular Black communities are as such that they are almost petri dishes for this disease to flourish.
And Libby, if I may just quickly,
Sure.
the question of sort of public health education, I think we can all agree that the messaging around, how to protect ourselves, what we should do, should we shut down our cities, should we shut down our states, has been muddled a little bit and not great and coherent for everybody. So as the public health expert I talked to in that piece you referenced said, if the message isn't, is sort of problematic for everybody, it's going to be even more problematic for communities that have particular issues with regard to access, or in the case of, say, the Latino community with language barriers, or just communities that are not plugged into, if you will, the public health system anyway, because for all the reasons we've talked about so far, they're shut out, they're not connected.
Great point, Vanessa. I want to welcome Eugene Scott to the conversation. He writes about politics and identity for The Fix. Eugene, you've been reporting on this push by lawmakers to try to get access to these statistics that Robert was just talking about, these vital statistics that could help shed more light on just what needs to be done in this country. So Eugene, take us through who's been leading the charge on that and what are they hoping to achieve?
Sure. Congresswoman Ayanna Pressley from Massachusetts has partnered with Senator Elizabeth Warren, and Senator Kamala Harris and Senator Cory Booker have also played a part in asking federal government agencies to track racial information regarding who is being tested and who is being treated. Because we know that the populations that are actually dying in many communities are disproportionately Black, but there's also a desire to see who is getting the attention from medical professionals that would be needed to make sure that these individuals get the help that they need. There's real concern that there could be bias from healthcare professionals based on data that we have that shows that doctors do not respond to Black patients with as much care and concern as they often do white patients. Examples of that are when Black patients say, these are my symptoms and this is what is concerning me and this is the pain that I'm feeling. Black patients are often viewed as perhaps exaggerating their inconveniences, or perhaps not even being as aware of their bodies and their health enough to accurately assess it. And so medical professionals often feel like, due to their education and their experience, they know more than the patients that they're facing, that they're dealing with. And this is not always the case when interacting with white patients. And so you have these lawmakers who really want to see what medical professionals have been doing in terms of their response to Black Americans and other people of color who are coming in contact with the virus.
So President Trump has now acknowledged that there is this concern about racial disparity. He talked about this at a press briefing earlier this week. And he said, we're doing everything in our power to address this challenge. It's a tremendous challenge. The president called it terrible. And we are seeing, Vanessa, an effort by the CDC to try to come up with these data points. So do we have a timeline on when the CDC expects to release the next batch of data that might have more information about race and ethnicity?
No, we don't. There was some information released yesterday, I believe, but I'm told, and I haven't had a chance to review it, that it was specific to a certain area, and it talked about hospitalizations. But what we've been talking about and what we wrote about, which is positive tests and mortality rate. Apparently that's not yet available. And they didn't say when it would be, but they said they were working toward it.
We've also seen the Surgeon General express concern about this. He's a 45-year-old Black man. Jerome Adams has come out and talked about his own personal experience and concerns with health. Vanessa, you've been monitoring that, tracking that.
Actually, I think Eugene probably looked at that more closely than I did. I'm gonna punt.
Yeah,
Totally fine. Eugene.
Yeah, one of the main concerns people have had with the Surgeon General is how inconsistent his messaging has been over the past month. We saw him swing from saying that masks weren't even necessary to actually trying to dispel whatever conspiracy theories have existed within some Black communities about whether or not this was a virus that could really harm these spaces. And so one of the issues, I think, a professor I spoke with who actually focuses on Black Americans' relationships with state and local governments has been the inconsistent messages people are getting from their government leaders, all the way from the Trump White House to local mayors and states. And so we know that a large percentage, if not most, Black Americans actually live in the South and are led by very conservative state leaders in politics. And sometimes their messaging mirrors that of the White House. And we know that this is an area that Trump has not been as forthcoming or at least accurate with. And this has directly affected how Black Americans have responded to this virus when they hear that things like masks are not that necessary, or the incoming White House press secretary saying coronavirus won't even come here. This definitely has shaped how people have behaved.
Robert, yeah.
Yeah, if I could jump in. The idea of concern is one thing, and the idea of action is another thing entirely. One thing we know is that in the jurisdictions where we see these grave disparities, they had the concern because they took the first step in releasing the data by race. They knew that was the issue. But when you go to places like Milwaukee, Wisconsin, you'll have public leaders say, well, we knew this would be an issue, but we actually don't fully know how to solve it because our ways of speaking to the Black community were through things like churches and community groups, and those things aren't meeting. So what are we going to do? So again, we're seeing a structural breakdown of how public officials deal with Black communities that's becoming a part of the problem. And I think the challenge that people are going to see with lawmakers is how to get to those communities when the simple ways that they've been trying to communicate to them for years, decades, longer than that, have broken down. And that in itself is a huge challenge.
That is very much the case when I know in particular it comes to churches and schools. I think we have overestimated the number of faith communities and students who have access to Wi-Fi in their homes. And so people often get information by going to these places, going to churches, going to schools, and hearing directly from their leaders, having information passed out. When they're no longer able to do that, it's not like they are finding new ways all the time to get that information. Very often they're just going without it.
Eugene, as you were reporting on the push that lawmakers are making to try to get the data, lawmakers are also trying to consider the next sets of aid packages and figuring out where money is supposed to go. So how do people like Congresswoman Presley and Senator Warren want to be able to use the data to actually make a difference and put research into action?
One issue Congresswoman Presley mentioned in a press call I was involved in last week is making sure that health facilities, hospitals, community health centers that primarily serve underserved communities, be they low-income communities, people of color, immigrants, or refugees, get the necessary funding that they need. These are spaces that were already under-resourced pre-pandemic, and they're spaces that marginalized community disproportionately relied on. So you have communities across the nation that are largely made up of people of color without hospitals. And so these residents often go to a community health center or urgent care facility that may not have a specialist at all to deal with this, or may be strapped already in terms of staffing. And so what the Congresswoman was saying is, let's make sure we don't look only at traditional places. Let's just not look at hospitals affiliated with nationally ranked universities that are far away in location from the predominantly Black parts of that town, and unable to serve those populations.
Robert, the Milwaukee community that you profiled and featured in your reporting, what are they doing? The headline talks about the community trying to take things into their own hands. What are they trying to do?
Well, the community in Milwaukee realized that the government was just not an effective way of getting the word out. And so what you saw were these grassroots from the ground up efforts to try and do something. You saw, if you walked around, you saw teenagers with bandanas playing basketball together. That's sort of on the point and not on the point, right? It's sort of this weird amalgamation of the two. But you also saw community leaders going out, live streaming on Facebook, talking about the importance of social distancing, and almost doing these kind of guerrilla gotcha moments with ice cream shops and at community parties saying, what are you guys doing? This is a huge problem. You guys need to break it up. And one of the most important things that I saw was that there are community organizers who said, okay, food pantry, if you can't open. In the Milwaukee County, there are 52 food pantries, 16 of them have closed. Others have drastically reduced their hours. And they said, well, if you can't open because you don't have enough volunteers, give us the food, we'll figure it out. And when I was over there, I was with a group that was trying to do this. And when they walked in and they saw the number of boxes, all the donations that had been given into their communities, they were touched by it. But it also emphasized a really important point, which was things like toilet paper, chicken, food, tampons, they were all there. They were just not here. They were just not within that community. And so it was up to them to go and give it out. And the question for communities like this is, if you're in a place where there's one grocery store that's swamped, and when you get there, all you see is empty shelves, what are you going to do? Are you going to be able to rely on the kindness of others forever? And I think that's a very dangerous and frightening prospect.
I want to welcome Tracy Jan to the conversation. She's a Washington Post reporter who covers the intersection of race and the economy. And Tracy, you and Eugene have both been looking at this question of the safety and wisdom of African Americans wearing face coverings, especially young Black men wearing face coverings. Robert was just talking about, seeing the guys playing basketball with bandanas on. But Eugene, let's start with you. What concerns have you been reporting on in terms of people thinking about their own safety, not just the safety of catching coronavirus, but the safety of how they're perceived by people who own a store or by the police?
Well, many Black men I've spoken with, and even some Black women, have expressed frustration about the tone deafness and lack of awareness of the CDC for even recommending that bandanas be an option. There seems to be some degree of ignorance about just how regularly people of color are racially profiled, even on any given day, without their faces being covered. And so to have a mask, a bandana in particular, which are very often associated with gangs throughout America's inner cities, covering their faces, I think some of the individuals I spoke to expressed fear that they could be profiled by police officers, and also that perhaps rival gang members could mistake them for being a part of an organization that they actually are not a part of. But I know Tracy did more about the impact that wearing bandanas could have on individuals as they try to engage the business community and other parts of our society during this time.
Yeah, Tracy, why don't you pick up on that for us?
Sure. Even without a bandana, the profiling has already occurred. Just last month in Walmart, 2 men wearing medical masks were actually told by a police officer who followed them into a Walmart in Illinois that they should not be wearing masks, that the local ordinances said you should not be covering your face, which was blatantly untrue. The men started recording and said that the police officer asked them to reveal their identities or leave. So the men chose to leave. I did not speak to two gentlemen, but I did speak to the police chief, who said the officer was wrong in saying that masks were not allowed, because they clearly are the national guidance these days. They're investigating this incident along with the local NAACP. So it's not just a theoretical thing. And it's not just masks. As Eugene mentioned, Black people are profiled just for existing in public spaces, for shopping, for going to Starbucks and having a meeting, for wearing a hoodie, walking down your street, going home. So these are very real concerns that people in the community have.
Vanessa, I want to go back to one point that you made in your reporting, that only 20% of Black workers, and this is compared to a third of white workers, can work from home, and women of color in particular, and they're doing jobs that are considered essential by society, as well as by the government even in some cases. They're taking care of children, they're taking care of the elderly, they're working in hospitals, they're providing food. That also, of course, puts them at such greater risk, Vanessa.
Absolutely. And again, that was another reason why that, we haven't done a lot of reporting on, but we should do more, because again, like we said before, it is not that there's something wrong with Black people. It is the conditions that, Black people disproportionately find themselves in. And in addition to those people having to go and work in those essential jobs, oftentimes they don't have health insurance. They don't have paid sick leave. So if they do get ill, they might have to keep going, not only because their job requires it, but they can't afford to not go. If they don't go to work, then they really don't eat. They don't get their rent and mortgage paid, and we're already hearing. I haven't done as much reporting on that, but we're already hearing from some lawmakers and civil rights activists concerns about how much of this the stimulus money is going to go to people like that, to people at the bottom. There's a lot of emphasis on businesses and people in some professions, but it's possible that people could fall through the cracks. And that again drove some of the concern you mentioned earlier, that with regard to how people responded to that Pew survey. So it's intersectional, interlocking issues that make this very tough for some communities and some people in communities of color, particularly low-income communities of color. Sorry.
Well, Vanessa and Robert, we're going to let you both go. Vanessa, any closing thoughts you want to leave us with?
No, just thanks for reading, and continue to give us feedback. And if there's stuff that you guys think we should be covering, please send me an email and let me know. Thank you.
Great. And Vanessa, I just want to read the headline of this story again that you reported. The coronavirus is infecting and killing Black Americans at an alarmingly high rate. I urge you to check that out. Robert, closing thoughts from you?
Yeah, I think one of the important things to think about as we continue to talk about this issue is that segregation does not necessarily mean poor. And when we talk about the disparities between races, we are not using race as a euphemism for people who are poor. There are victims in Milwaukee who are middle and working class people who are still suffering the same sort of conditions because of structural things like redlinings that force them into particular neighborhoods. And so I think as we continue to have these discussions, it's important that we recognize that it's not just low income people. There are people who have lack of access to things like grocery stores and things like hospitals because of how segregation in America works.
Robert, thank you so much. Appreciate
Anytime.
it. Eugene and Tracy, stay with us. Tracy, you've been looking at essential workers, and we're going to pivot the conversation a little bit now to keep going on this question of essential workers and just who is really on the front lines of putting themselves at risk. So one group in particular you've been exploring are undocumented workers, who make up sort of the hidden, to some, backbone of the American economy. What are you finding that undocumented workers are facing in terms of putting themselves at risk and also their employment?
That's right. They're actually hit on two fronts. Undocumented workers are hit on two fronts. They're both overrepresented in the industries in which like hotels, service jobs, restaurants that have laid off a ton of workers. And because they're not US citizens, they don't have social security numbers, they are not eligible for the stimulus money, the $1,200 check that people are supposed to be getting some point this year. On another hand, they are also overrepresented in essential jobs. So they are actually putting their health at risk by continuing to go to work in the farms. A lot of them are agriculture workers. A lot of them are healthcare workers. They work in nursing homes, taking care of our elderly. A lot of them are home health aides who come into our homes. A lot of them are nannies. So these are the people that are oftentimes going on public transportation, exposing themselves, not exposing themselves, but exposing themselves to the risk of contracting the virus. And oftentimes they don't have personal protective equipment, nor do they have health insurance, and definitely they don't have sick pay.
I want to talk more about that, but Eugene, we had a question come in from one of our readers. Mary Ellen wrote in from Wisconsin and asked about Native American communities. And she points out that they are at risk because of health problems, also healthcare shortages in their communities, and there are oftentimes close living situations. Some of those families we were talking about, where you might live with grandparents and multi-generational, you might live near aunts and uncles. So Mary Ellen would like to see more reporting on this and more digging into this, but there are certainly questions being raised about just how prepared Native American communities are.
Absolutely. And Native American communities are a largely undercovered community throughout the mainstream media when it comes to topics of racial disparities. And nearly every issue that we've described affecting Black Americans and many Latino Americans and Asian Americans is hitting Native American communities even harder. There are communities that are largely isolated from mainstream society as a whole, and far more under-resourced in terms of healthcare facilities, education, and businesses and other institutions that have historically provided answers to these questions, and the assistance needed to respond to these crises. One area in particular that I saw domestic violence, it's domestic violence in Native American communities as more people are in stressful situations, staying at home, not able to distance themselves from environments that are unsafe. And so one of the things I think this time has introduced to us is that physical health is not the only type of health that is at risk for many populations. Mental health and other factors that keep us safe are falling apart.
Tracy, as you've been reporting about some of these essential workers who are undocumented, what they're facing, you brought up so many important points about not having access to the stimulus money, having jobs that are considered essential. I want you to talk a little more with us about essential and like what it really means to be essential in our country right now.
Well, different localities have different definitions, right? In some cases, New York and San Francisco have defined construction as essential, but that also includes building luxury apartments that some might not deem essential, but people are going to work. And again, putting their lives and their coworkers' lives at risk. One construction worker I spoke to in New York, her project was actually put on hold. So she was laid off. She made pretty good money as a construction worker. The next day after she went home, she felt ill. She had a fever, all the symptoms of COVID-19. She had vomiting, headache, fever, and she sought help, which is unusual. A lot of people without health insurance don't want to seek help. They don't trust the healthcare system. But she had advocates call several New York hospitals for her and was told to stay home. And if you stop breathing, call 911 and we'll come pick you up. And it says a lot about, what state New York is in right now in terms of the crises there. But I was talking about the fact that a lot of undocumented immigrants don't trust that going to the hospital will do them any good, not only because they don't have insurance, but there have been cases of ICE, Immigration and Customs Enforcement, being at healthcare facilities in the past. The Trump administration has issued guidance saying that we're going to no longer enforce immigration law as strictly during this pandemic. We will definitely not be around hospitals, but people don't trust that. Advocates are saying that field offices it's up to their discretion to determine what they want to do. There's a lot of leeway. There's also, the Trump administration has also had a new rule that came out in February that would impact immigrants who are trying to get green cards, trying to get permanent status. And the rule was that if you were it's called public charge, if you were using Medicaid or food stamps or other safety net services for a while, that would count against you and you would be less likely to obtain your green card. Since COVID-19, since this coronavirus epidemic, pandemic, the administration has said they would not hold it against anyone who sought health care to treat coronavirus.
Eugene, local leaders are struggling with this issue of like encouraging people who do need medical care to go to a hospital. I know the DC Mayor, Muriel Bowser, was encouraging people not to wait too late, especially as Washington, DC is one of the communities that's seeing a staggering rate of African-American deaths. And so local leaders are trying to figure out how to get the word out that if you are in distress, the hospital is the place to go, even as they're discouraging people who aren't in severe conditions to rush to the hospital.
That's absolutely true. I was speaking to some Black residents and other individuals from low-income communities who have said measuring and determining when I am sick, hospital level sick, is a challenge, considering that I have lived with health ailments untreated for years and have just made myself learn to make it work or walk it off. And so you're dealing with people, and we see this in a lot of the deaths of people with COVID who have countless health ailments that have been ignored and not given the amount of attention that they certainly needed prior to this. And so fever, I think some people would be surprised at how many people deal with fevers and, vomiting and some of these other ailments, and just keep going and go to work the next day and made up in their minds that it's not as big of a deal as it actually is. And that's been a real challenge for a lot of people in the medical community who have determined that they could have perhaps saved some lives had they come earlier.
Mm-hmm. And of course, if you're someone who doesn't have health insurance, you're used to trying to push through it and not get medical care if you're concerned about a really hefty bill. So important point. Eugene, Scott, thank you so much. We're gonna say goodbye to you and welcome two more of our guests. Lori Aratani, transportation reporter for the Post, and Lenny Bernstein, health and medicine reporter, will be joining us in just a moment. We're going to continue our conversation about essential workers and just who they are and what they're coping with. Lenny, welcome. Thanks so much for joining us. Before we get to you, Lori and Lenny, I just want to hear a little more from Tracy about the question of workers who are used to crossing borders and the movement that typically happens to help harvest America's food, to catch America's fish and crab. What are the concerns about this routine migrant movement that happens?
Right. So in addition to the undocumented workers who've often lived here for decades and have US-born children who pick grapes and work on American farms, there are also migrant workers, oftentimes from Mexico, or other parts of Central America, who come over on work visas. These are the H-2A visas. The concern now is that the State Department has shut down a lot of the embassy work in Mexico, move it remotely because they're concerned about face-to-face interactions to stop the spread of COVID. And so a lot of farms, fisheries, were worried that they wouldn't be able to get their workers. This announcement was made a couple of weeks ago, and I think since then the department has allowed more people who don't need face-to-face interviews to get processed. So hopefully it's not as dire as people fear it will be.
Lenny, we've been talking about what defines an essential worker. So healthcare workers obviously are essential, and I say obviously because they are keeping Americans alive in many examples. They're staffing hospitals, they're staffing clinics, they're trying to give tests to people when tests are available. But as you talk to healthcare workers, how are they dealing with this label of being essential? Are they getting paid properly? Or do they yet feel like they have proper and adequate gear to protect themselves?
depends on where you are. In places like New York, there's still people asking for proper gear. They're still trying to make masks last longer than they should. Now, every time a nurse pops into the room of somebody who has this infection, he or she is supposed to dispose of that mask. And that is clearly not happening. They're using them for an entire shift. In some cases, they're making them last longer. Now, I will say, in some places, the infection has not spread as quickly as it was expected to. And I imagine things are fine there, that they have enough PPE, that they're using their equipment as they normally would. The other thing we're running into is the paradox that because so many facilities have canceled all their elective procedures, there's a huge shortage of revenue. And there's actually some concern that there will be pay reductions or even layoffs in some places because hospitals can't afford them.
Laura, you've been covering the transportation industry for quite a while, and you're reporting on flight attendants and people who work for the airline industries who are still at work. I mean,
Right.
so many of the flights having been grounded or, missing out on opportunities for travel to see family or do a work thing. But there are still people flying and there are still planes flying.
There are indeed, and flight attendants are getting even more worried about themselves. I mean, they see themselves as first responders in a different way, but when you think of it for them, they feel like they live in these parallel universes where when they're at home, I talked to one flight attendant who lives in New York, she stays home, she doesn't talk to anyone but her family, she doesn't go out, and yet when she goes to work, she's doing everything they tell you not to do, right? She's going through an airport and then she's in an enclosed space with strangers. And even though there are far fewer people that are flying these days, there are still people that are flying. And a lot of them feel like they don't have the proper equipment. Early on, they had asked to wear masks before CDC had changed the guidance, and airlines were really leery of that. They said they wanted to follow the CDC guidance. Finally, they said, okay, flight attendants, you can do this. And then, of course, the CDC changes. But by then, a lot of these shortages that have plagued other industries, right, even in healthcare, there aren't enough masks, there aren't gloves, there's not hand sanitizer, there's not soap. It's also true in the airline industry. So even though they're flying, they feel like they're not being protected either.
Tracy, what sort of protective measures are being taken to help essential workers who are, picking the food in the fields and doing a lot of the back end work to get groceries to Americans?
Oftentimes nothing. I spoke with one woman who is in Ohio. She's a farm worker there, and she has to bring her own soap from home. They don't even have running water, she says, to wash their hands. So she takes drinking water that they're given during break and washes her hands with her liquid soap that she brings from home. When she gets back home, she strips down at the front porch, puts her clothes immediately in the wash, and takes a shower before she even allows her kids to give her a hug. But she's working alongside migrant workers who live on these labor camps right outside of the farms. They don't have access to laundromats. They have to drive to them. I think they might only go once a week, depending on where you are. Also, the bathrooms the bathrooms are outside. They don't live with indoor bathrooms. So she's very concerned that she could be contracting something from her coworkers.
You point out a scenario where a county health department has told farm workers to stay 6 feet apart, but you talked to a woman who said that's just totally impractical given the kind of work that they do.
That's right, especially when they're unloading the plants and planting them in the nursery. They have to work together, so they're physically in close proximity.
And you reported that her employer did take temperatures at first, but then stopped doing that?
That's right. The employer took temperatures for a week and then stopped.
So, Lori, who decides that a flight attendant's essential? I mean, take us through just the who's in control of that decision-making process.
Well, that's that's the administration, the Department of Transportation, the FAA. They've decided that we need some sort of air service even now. A lot fewer people are flying, but still we need to get first responders where they need to go. We need to get families. If there's an emergency, we need to enable them to be able to get where they want to go. And also, a lot of planes, we know that they carry passengers, but they also carry cargo. So, if we want to get masks from one place to another place, oftentimes they'll fly them, right? So there's also that's the reason why a lot of planes are flying. I know a lot of folks don't understand because so few are so full now, but the government sees this as an essential service for keeping communities and cities connected. And as a result, flight attendants, pilots need to fly. They're considered essential.
Lori, how much do we know about rates of infection or even deaths among the community of flight attendants and people who work in that industry?
So airlines have been very mum on this, but a lot of the unions have been collecting data from their members. So we know that about 250 flight attendants have tested positive for COVID-19. I think there's about 100, more than 100 pilots, about 135 pilots, I think, have tested positive. And these are for folks who can get tests. I mean, that's another issue, right? Which is who's an essential worker. I mean, there might be a flight attendant or a pilot who feels like, they might have it, but if they don't exhibit symptoms, they might not be considered to have a test. So there could be more people out there who are flying who have it. And, they're concerned for themselves, but they're also concerned for their families and also for passengers, because you can be asymptomatic. There was a flight attendant who was working in flying between New York and Florida, and she said she flew a 2-week span. She felt great. On her day off, she had a little bit of a scratchy throat, and she thought it was allergies, and now she's in the hospital for COVID-19. So you just don't know, but there's that time that she flew, and you don't know.
Lenny, we got a question written in from Kay, who lives in Maryland, and asks if we know how many U.S. healthcare workers have been infected or died. Lenny, do you have a sense of how that's being tracked and monitored?
It's fairly patchwork, hospital to hospital, state to state. I have not seen a total. I would estimate now that there are thousands of healthcare workers sick. A few have died that we've heard about anecdotally. I'm sure we'll get totals when we get out of the heat of battle here. But in every infectious disease outbreak, healthcare workers are always the second largest group affected, other than the general population. And I have no doubt that'll be the case in this one.
Leslie wrote in from Honolulu and pointed out that some occupations like grocery store workers are considered vital. And Leslie wants to know, shouldn't they get some kind of hazard pay or combat pay for their contribution to society and what they're risking right now? I'll throw that open to the group in terms of discussions happening. You hear a lot of mayors and governors, even at the federal level, praising these essential workers. But there is the question of just what recompense they'll get after this is all over.
There is talk on the federal level. There's talk about another fourth stimulus bill, and there is talk about hazard pay for certain classifications of first responders up to $25,000, depending on what your salary, what you make. I know here in the DC region in Howard County, Maryland, the county executive there has signed a measure to give, I think, hazard pay to certain classifications of first responders. So it's certainly something that's on the mind of lawmakers, whether or not it's something that they can push through at the federal level. There might be states that decide that they want to do it, and we'll have to see how it gets distributed and who benefits.
But Tracy, the question is, of course, just who's accounted for. I mean, who is considered to be essential on the books versus off the books?
Right. I was going to add to the hazard pay. Some employers are already stepping up and adding, pay to their workers on a company by company basis. And there have been grocery workers who've died, at least 4 around the country so far. That was just last week. The numbers may have gone up this week, and there will no doubt be more people getting sick as they continue working.
And the grocery store clerk is just the last line of that food chain. That literal food, getting the food from the field or the farm or the sea to our homes. So Tracy, even if there is talk of trying to do extra compensation for people, what does that mean for the undocumented workers?
Right. They're basically not going to get anything. Nothing that comes through the federal government is going to go to them. There are some local municipalities and activist group are pushing states to compensate them because they are not getting part of the stimulus. So we'll see. There's various fundraising efforts on different groups' parts who are trying to raise money for them to have food and pay rent.
Lenny, hospitals are not just run by the professionals who actually see patients. There's a whole line of people right behind that who are cleaning and helping and providing. Um, do those people have protective gear? Are they being taken care of in this?
From what I've seen, they do. They're suffering from the same deficiencies in gear that nurses and pulmonary techs and doctors are suffering from. They're equally at risk. They have to come in after a procedure is done, say a patient is intubated, clean the room. As has been well documented, during an intubation, the virus is aerosolized, it goes around the room, and people have to come in and clean it. They have to have masks so they don't inhale that stuff. They have to have booties on their shoes so they don't, step on it. They have to have gowns. They're basically in the same ballpark as healthcare workers, and where it's good, it's good, but where it's deficient, they are putting themselves in the same kind of risk.
And you and our colleague John Gerberg reported about a Brooklyn ICU and how the nurses and doctors were coping with this. Can you just give us a sense of your reporting and what those professionals were experiencing?
We were there about a week ago, and it was really kind of at the height of the influx of patients into the ICU. They were not just overwhelmed with the sheer amount of work that they were doing, which was enormous, but also with the stress that they were undergoing and the fact that for the first time really ever, they had banned visitors. So from an emotional point of view, they were the only connection between these patients and the outside world. So they had to keep families apprised of what was going on. They came in and offered emotional support to people, most of whom were sedated and couldn't actually hear them. But the nurses that we spoke to said it's still part of care to offer emotional support, to offer a pat or to speak to them, to just try to treat them as if they're there and they're sentient, because who knows, you never know. All of this plus the gear situation, which in this one hospital we went to was fairly good, was just overwhelming the staff. It was more than they could handle. And one of the best things that I've seen happen in the last several days is the influx of volunteers into New York from other places. So just so these people could get a little bit of a rest.
Before we let you all go, Lenny, what are you going to be watching on your beat, on this health beat, and the healthcare workers in particular over the next couple of days?
I'd like to see how, as New York starts to slowly, and I want to say very slowly, leave the crunch, leave the worst of the crisis, where it goes next and how badly it hits. So every day that a city buys to prepare for this is a reduction in how bad it's going to be. Maybe only a tiny, tiny bit, but if it takes an extra day or 2 days or 3 days to get to Chicago or Cleveland or Des Moines, that is time to prepare, to get your equipment in, to get more gear, to get more staff, to open more beds. I want to see if the middle of the country does better than the coast.
Tracy, what are you watching?
We'll be continuing to track the racial disparities in infection rates, as well as testing and other economic racial disparities in terms of who has access to small business loans and other stimulus funds.
And Lori, what are you going to be watching now as you keep reporting on the airline industry and transportation?
Well, we're going to be watching how the industry survives. As you know, airlines are in deep trouble. They've had to make a lot of cuts. A lot of workers are they're guaranteed their jobs, I think, through September, but we're going to see how the industry emerges. It's not just the airlines, right? It's other transportation sectors. Subways are shutting down, buses, they're all essential to try and get essential workers where they need to go. So we'll be keeping an eye on that.
All right, thank you so much. And Lenny, one last final question for you. Since you were at the hospital last week reporting, are you doing some kind of deeper isolation, or how are you protecting yourself and your family right now?
Yeah, so I went into self-isolation for 14 days. I'm away from my family for 14 days. That's the incubation period of the virus. After 14 days, it's generally believed to be safe to go back can, live with my wife and daughter who are in the house. But for now, I'm just away from them for 2 weeks. So's John.
Well, if you get lonely, give us a call. We'll talk. We'll Zoom with you. Thank you. Thanks so much to all of you. We really appreciate your time today. Tracy Jan, Lori Artani, and Lenny Bernstein, thank you for your reporting. And thank you to our audience for joining us. If you're watching on YouTube, you can click that subscribe button and you'll get notified of videos and information coming from the Washington Post. And I also would encourage you to subscribe to the Washington Post to help support the reporting of my colleagues who you've just been hearing from and keep their work going. I'm Libby Casey. Thank you so much. Stay safe, stay healthy, and we'll see you next week.